that are happening with Medicare for 2025. This is probably going to be the biggest changes I have seen in a very long time with Medicare. So we're going to talk about those changes today. There are many plans that are leaving the Bronx area for 2025. So there's a lot of disruption. There's also going to be a lot of disruption in Medicare Part D. Okay, there's significant premium increases happening for some of the standalone drug plans. As many of you may know, you may have been notified. We're going to talk about that today. We'll talk a little bit about some of the Medicare 101 stuff, but this is really going to be about the changes happening with Medicare for next year. Okay. I'm going to, next slide, please. So if you have questions or you want to review something, feel free. You can call, pick my brain. If you are on a retiree plan, that stays intact. We don't want to touch that coverage. So if you are a city retiree or have some type of coverage through a former employer, that coverage, we do not want to touch that. Please call your union to ask what the changes are with your plans. But this is for anyone on individualized Medicare plans. So that's individual. Yeah.
All right, since Caitlin is presenting, it's really hard for anyone online to hear if there's any chatter, right? Because the owl is gonna pick that up. So while she's presenting, can we remain silent, please? Any questions that you may have for Caitlin, just write it down and then she'll answer them at the end of the presentation. Okay, thank you.
Okay, so yeah, so this, like I said, anyone have questions, if you want to reach out to me in regards to your individual plan, please do not hesitate. But anyone who's on a retiree plan, you have to call the union. If there is any changes coming up for the new year, they will know. So this is in pertaining to individualized plans, okay? So that's individual Medicare Advantage, individual Medigap, and drug plans. Can you hit the next slide for me?
Please silence.
So what we're going to discuss today is the 2025 changes to Medicare, the 2025 Medicare premiums and amounts, and the biggest thing that's going to be happening is the Inflation Reduction Act. We saw some of that enforced this year. It is going into full effect in 2025.
Sorry.
Hold on one second. We're having a little technical.
Hold on.
All you need to hit is enter on the slide.
Sorry.
Okay. Just hit enter. Yeah. So we're going to talk about the 2025 Medicare premiums and amounts, the Inflation Reduction Act, which is going into full effect in 2025. Donut hole's gone for next year. So we're going to talk about that in depth. The New York's consumer protection laws, which we always talk about every year because it's important to know these consumer protection laws because they really do benefit you in New York. The pros and cons between Medigap and Medicare Advantage, because I get asked that question all the time. And so we will talk about that as well. And New York Epic, which is a state pharmaceutical assistance program. Okay, so that's what we're going to really cover today. And Gigi, if you could go to the next slide.
Okay.
And can everyone hear me online? Okay.
Yes.
Okay, thank you. Back.
Yes.
Back, you want?
Yeah, that's you skipped the slide. Right there, right there. Okay. So, okay, you're good, you're good.
I just want to
Okay,
make sure to put this down.
Perfect. Okay, so we will not have the official numbers from Medicare until the next 2 weeks, but this is what the estimates are. The COLA has already been announced. So your Social Security will increase 2.5% for 2025. Everyone knows that. That has been announced. Okay, so for right now, the standard Part B premium that most seniors are paying is $174.70 a month. This is what you're paying most seniors in the year 2024. As many of you know, if you are in a higher income bracket, so if you're in a higher income threshold, you have to pay more for your Part B premium to Uncle Sam, but most seniors pay $174.70 per month, or if they have Medicaid, Medicaid might be paying it. But we anticipate, the estimate is, according to multiple studies, that the standard Part B premium for 2025 will be $185 a month for next year. It's not going to be officially released till in a couple of weeks, but usually the increase is always around $10 to $15 every year. So that's what we anticipate. Okay, the 2025 Part B deductible this year is $240. So what that means is if you're on traditional Medicare, right, you have a $240 deductible you need to satisfy first when you go to the doctor, right? Once you satisfy that deductible, then Medicare Part B pays 20% or your supplement. Okay, we anticipate next year the deductible will be $250 to $257. These are very close estimates, but this will officially be announced in a couple of weeks. So when you come to my seminar in November, you will have the handouts citing all of those amounts for 2025, because that's when they release it. It's always towards the end of October into early November is when Social Security announces the amounts. All right, you could go to the next slide. Just hit enter.
Sorry. There's just, I don't have the mouse. So
You can just hit enter on the keypad.
Yeah. No, I won't do that. Right
there we go. I'm there. You just got to get rid of that. That's distracting.
Yeah.
There
You do that every single time.
All righty. So when we look at these numbers, you're looking at if you just had traditional Medicare only, right? Your red, white, and blue card, and that's your insurance. You don't have anything else. You don't have a Medigap. This is what people would pay in 2024. This goes up every year a little bit. So the amounts have not been announced yet, but we anticipate that deductible for hospitalization is probably going to go up another $40 or $50. But this is what people would pay if they had traditional Medicare only and they were in the hospital for 60 days. They would have in 2024, this is the deductible they would have to pay. Then after day 61, they'd have to pay $408 a day, right? Then after that, they'd have to pay $816 a day. This goes up a little bit every year. So, but it's going to pretty much look the same for next year with a couple of dollar increases. Right? But if someone was in the hospital for 150 days, let's say, they could potentially pay almost $50,000 on traditional Medicare. So they have some kind of supplement to pick that up or fill in those gaps, right? This is just if you had traditional Medicare only. Okay. For skilled nursing care, the first 20 days, traditional Medicare pays that. So you do not have a copay. But after day 20, you would have to pay $204 a day, days 21 through 100. That is expected to go up to $214 per day, days 21 through 100 for year 2025. Okay. But it will officially be announced in a couple of weeks and we will have those exact amounts for you. But this is what people would pay on traditional Medicare only, right? Without anything else. That's what we would see. So we can go to the next slide. And again, this is under traditional Medicare Part B. If you just had traditional Medicare only, did not have any type of supplemental plan, you would have to satisfy the Part B deductible of $240. This is his hat. That's why. Yeah, we'll have to open it again. So the deductible we anticipate will be $250 to $257 next year. If you're on a Medicare Advantage plan, this does not apply to you because you have your own set of co-payments that you need to pay that are specified under your plan. Okay. But anyone who's on traditional Medicare with a supplement, right, these can apply to you. So for next year, again, we anticipate the deductible will go up to $250 to $257. Has to be satisfied once for the calendar. Your questions are at the end of the presentation. Right. So when someone pays that deductible, which is for your diagnostic related doctor visits, wellness visits do not count towards this. So if you are doing a wellness checkup, you're doing your mammogram, right? Anything preventative does not apply towards the deductible. But if I have, high cholesterol and I'm going to see my cardiologist, that is diagnostic. I'm going to have to satisfy my deductible for the calendar year. Once I satisfy that deductible, then my Part B kicks in paying 80%. And I'm paying the 20%. Or I have a Medigap plan that is picking up that 20%. Okay, this is traditional Medicare. Now, if you just have traditional Medicare only, you don't have any other secondary with it, and you are going through something like chemotherapy or something more catastrophic, traditional Medicare by itself does not cap your out-of-pocket costs. So federal red, white, and blue Medicare does not say, Caitlin, you spent $10,000 in medical expenses. We are now going to cap you, and now we will pay 100% of all your medical costs for the remainder of the year. Traditional Medicare by itself does not cap your out-of-pocket costs. So the 20% is really not bad when it comes to doctor visits and things like that. But where it can become very expensive is if you're going through something like chemotherapy or immunotherapy, or let's say you're under hospital observation or put into the emergency room. That falls under Part B. And a lot of people don't know that. That can be quite expensive. So there are gaps in traditional Medicare by itself. And this is basically what it's talking about. And you know, one thing to know with preventative care is although it doesn't apply towards the deductible, that's only if Medicare does not, if your doctor doesn't find something abnormal, right? If I go in for a mammogram and they find an abnormality, that is no longer preventative. That is now diagnostic because they now have to diagnose what's going on with me, right? Now I would probably have to satisfy my Part B deductible. Okay, G, go to the next slide. So as comprehensive as traditional Medicare is, right, there are holes in it. So many of you are likely, you know, maybe you want to keep traditional Medicare, you have to get what's called a Medigap plan, also known as a supplement. It's the same exact thing, it's just synonymous, right? When you look at these plans, you have to look at it under what traditional Medicare costs, because these are just there to make your red, white, and blue Medicare more complete. So if I pick the option of a Medicare supplement plan, my red, white, and blue card stays perfectly intact, right? The doctor bills Medicare, and then my supplement or Medigap plan is just there to pick up what my traditional Medicare does not pay for, right? It's there to make my red, white, and blue Medicare more 100%, right? More complete. So these are the different Medigap plans that we have. They're standardized. It does not matter what company you go to. A Plan N is exactly the same, whether it's Humana or United Healthcare, but what will vary are the premiums, right? So the premiums can vary. But when you're looking at these plans, you have to look at what traditional Medicare costs. So if for 2024, if I get admitted into the hospital and I have to pay a $1,632 deductible under traditional Medicare, well, these are the plans that are going to cover that deductible at 100%, right? And then there's the plans that won't cover it, right? Skilled nursing we were talking about, right? What do we say about skilled nursing? After day 20, I have to pay over $200 a day, days 21 through 100. Well, these are the supplement plans that are going to cover that cost sharing at 100%, and then the ones that are not going to. The most common ones that people enroll in is Plan N and Plan G. Those are the most common Medigap plans that people enroll in today, right? C and F can no longer be purchased unless you turn 65 before January 2020. And the reason for that is because any of the Medigap plans that covered the Part B deductible, Medicare found that there was a lot of waste where people were overutilizing it and it was costing the government a lot of money. So macro was passed in 2015. And now people who turn 65 from January 2020 onward can no longer purchase Medigap plans that cover the Part B deductible, okay? They have to get either something like G or N, but G and N are definitely the most common. All right, you can go to the next one, yeah. And just a visual, when you keep your traditional Medicare intact, you use 3 cards for everything. I call it the a la carte option because you have 3 premiums you have to pay every month. You have to pay Part B to Medicare, right? You have your supplement premium and you have your drug plan premium. Those are 3 premiums you must pay every month. You can go to any doctor in the nation that takes traditional Medicare, okay? There are no prior authorization rules with Medicare. There are coverage rules, but typically you have a lot more flexibility, and the doctor does have more flexibility in managing your healthcare, okay? So you do tend to have predictable out-of-pocket expenses. This really does work well for people that have health issues, because if you're someone that's a high utilizer of healthcare, on these kind of plans, especially Plan N or Plan G, you tend to have very little out-of-pocket costs. So it's predictable in that way. You could go to the next slide. Here are some of the cons if you are New York State. New York State is one of the very few states that does not do underwriting. So what does that mean? Well, when you go on the general Medicare website, it will say something like, when you're new to Medicare, you have a 6-month open enrollment period for a Medicare supplement plan. This does not apply in New York State because New York State is a guaranteed issue state, meaning we do not ask health questions. So regardless of your health status, as long as you have Medicare Part A and Medicare Part B, New York State Medigap plans will accept you. However, the downfall of that is that these supplement plans in New York are very expensive because of the fact we are guaranteed issue. See, most states like New Jersey and Pennsylvania and North Carolina and Florida, when you're first new to Medicare, that means that it's the first time you're eligible for Medicare, 6 months from your Part B start date. In those 6 months, when your Part B takes effect, That's the only time you can get a Medigap or Medicare supplement plan without any health questions asked. And then after that window has ended, you have to answer health questions. And if you're not a healthy individual, those plans do not have to accept you. And for that reason, in states like North Carolina, I'll just give you an example. A 65-year-old woman in North Carolina can get a Plan N for $80 to $90 a month. That same exact plan in New York is about $240 to $270 a month for a 65-year-old woman, because we are guaranteed issue. So for that reason, the premiums can be quite expensive here, right? So if you want something that gives you for almost first dollar coverage in Bronx County, you're looking at between your Part B premium, your drug plan premium, and your Medigap premium, and this is 2025, you're looking at least $490 per month in total between those three, okay? Another con is they do not offer any ancillary benefits such as dental, vision, or hearing. So if you want those benefits, you're going to have to purchase a standalone dental plan or vision and hearing plan, which will result in additional premiums. These premiums can increase over time, which can make these policies very expensive for someone who is on a fixed income. There's always pros and cons with anything, but it is excellent coverage. A lot of doctors take Medicare. Approximately 96% of doctors in the country take Medicare, could be a little lower than that. So you really do have flexibility, but it is expensive on the front end because you have to pay that amount, whether you go to the doctor or not. You could go to the next slide. And I just want to talk about some of our consumer protection laws about New York. So a couple of things to know. We are a guaranteed issue state, which does work in your favor in that way. There is something called Part B excess charges. So there are some doctors, specifically psychiatrists, where they may accept Medicare, but they do not accept Medicare assignment. So that means if you see a provider and you do a visit and the Medicare rate for that visit is $100 and that provider does not agree to Medicare assignment, in most states, they could bill a 15% excess charge on top of that amount. Right? In New York, it's a Medicare overcharge measure state, meaning they are not allowed to bill a 15% excess charge. They can only bill a 5% excess charge. And I can tell you in most cases, very seldom do I ever see the excess charge. But when it does happen, it's typically a psychiatrist, something like a podiatrist, you know, a doctor that's maybe not affiliated with any medical group that has like a private office. It does happen sometimes. But it's, again, New York has a lot of good regulations set in place to protect beneficiaries. So, but it's a good protection we have, and the fact we are guaranteed issue. So regardless of your age or health status, we are guaranteed issue, but just keep in mind that if you have just traditional Medicare only and your house cap is on fire, you now have cancer and you want to get a Medigap plan, you can do so, but they will institute a waiting period from 2 to 6 months, depending on the plan, before they will pay for anything related to your cancer. So if you have traditional Medicare only, and now you want to get one, just keep that in mind. However, if you are consecutively switching out of an Advantage plan to a Medigap plan, or one Medigap plan to another, or a retiree plan to a Medigap plan, consecutive switch, the waiting period is waived entirely. No pre-existing condition. Only for the people who just had traditional Medicare only and now want to buy it because their house is on fire. And you can find this on dfs.ny.gov because New York State regulates these plans, not Medicare. It's regulated by the Department of Insurance. You can go to the next slide. So are there any questions on that? If you want to write it down, save it for later, I'll answer them. You go to the next one. So let's talk about Medicare Advantage. Now, Bronx County, we have a very high cost of living here. As many know, it's very expensive here. So Medicare Advantage is probably becoming the more predominant option in Bronx County, as well as most of downstate. Now, what happens with Medicare Advantage is you are still part of the Medicare program. You still have to pay your Part B premium. However, what basically happens is your red, white, and blue card, it no longer is going to work. It's as if you're taking a private insurance company and slapping their name on top of your red, white, and blue card, right? There are rules you need to follow. So you typically, I call it the all-inclusive option because you're using one card for everything in most cases. You use one card for the doctor, one card for the pharmacy, right? Same card. If it has dental, you're using the same card for the dentist. And when the doctor sends in a claim, they're not sending it to traditional Medicare. They're sending it to the private insurance company, right? And basically how you're protected on a Medicare Advantage plan is many of them are going to be very low in premium or have no premium. So you're just paying the Part B premium every month, and you essentially pay as you go. So you're going to have co-payments on your Advantage plan. And what happens is the insurance company becomes your accountant. So they'll say, if my plan has, let's say, a $7,000 maximum out of pocket, and I spend $100 for an emergency room visit, the insurance company is going to send me what's called an evidence of benefits and say, hi, Caitlin, this is what you've spent so far towards your maximum out of pocket. You put $100 towards your plan's $7,000 maximum out of pocket. You now have $6,900 before we will pay 100% of your medical expenses. So that's what a maximum out of pocket is. It's not a deductible because the plan is covering you. When you pay copays, the plan is still covering you. It's just, they're not 100% covering you. You're still having to pay copayments for things, but you have a safety net. And if you hit that maximum out of pocket, then the plan will pay 100% of your medical costs for the remainder of the calendar year. And then it restarts again come January 1. So how an Advantage plan really works is it essentially takes that 20% you would pay under traditional Medicare and it breaks it down into copayments, right? The doctors still have to take Medicare, but you are going to have to use a network in most cases. So let's go to the next slide. And I'm going to show you what they look like. So this is not an actual plan, but this is what Advantage plans structurally will look like in Bronx County, right? Plans can vary from, the co-payments could vary a little bit from company to company, but this is basically what you're going to see, right? It kind of looks like major medical insurance. So if you are on commercial insurance with your employer, right, everything has a copay. And you could see it says for MOOP, $9,550. Now, 2% to 3% of people on Medicare ever hit the MOOP each year. So there's a 96 to 97% chance you're not going to. But it's there to protect you because what did I say earlier? Traditional Medicare by itself does not cap your out-of-pocket costs. So this is another way to, receive your Medicare benefit, but there are rules you're going to have to follow. So again, everything is accounted for. And all medical costs, right? If I have a $275 copay for an MRI on my plan, that's going to count towards that maximum out of pocket. Everything has a copayment and it's broken down. So the Medicare costs for hospital that we were going over won't apply to someone who's on an Advantage plan because you're going to have to look at your plan's summary of benefits to see what the copayments are for you specifically. Every plan is going to have a different set of copayments, a different network. Advantage plans will vary, and there's multiple plans per insurance company. And it is based on the county you live in. So the plans that are available for Medicare Advantage in Westchester County are completely different from Bronx County. All right, you could go to the next one. And this is the benefit structure of a Medicare Advantage PPO, right? And you notice there is in-network and out-of-network. So if you go out of network, you're going to pay more. If you stay in the network, you're going to pay less. You don't need referrals usually on a Medicare Advantage plan. They're probably one of the most popular routes that a lot of people go. But as you could see, the maximum amount of pockets, that's ballpark what we're seeing for 2025 on a lot of these plans. And that's why I'm putting those numbers there. So you can see that, if you pay as you go, but if someone has a lot of health problems, this could become quite expensive for them. So if I'm a person that is a high utilizer where I'm going to several specialists a month, and there are some people that are high utilizers, those co-payments can really start to add up and become very expensive. Okay. You can go to the next one. Now everybody thinks they're eligible for these kinds of plans. This is called a dual special needs plan. And the commercials are crazy because they tell people, tell seniors, oh, you're eligible for a $3,000 a year from Social Security and you could get a $300 a month food card. It doesn't exist. There is no Advantage plan in Bronx County that offers a benefit like that. There are some plans that will have a benefit for people that have both Medicare and Medicaid, but most people are not eligible, and it's very misleading marketing. But these plans, they're very popular. They have a food benefit. A lot of them will have like a food card benefit and $0 copays, because for people that have Medicare and Medicaid, what's basically happening is their Medicaid is paying their copays, right? So that's why they have these $0 copays. So you could go to the next one. But these are typically what the benefit structure of these Advantage plans look like. And those are the most common. So this is the cons of the Advantage plans. In most cases, you do have to use a network of providers, even on a traditional HMO. You can only go out of network in a medical emergency if you're on an HMO. So if you're on an HMO plan and you're outside of your service area, if it's a medical emergency, you'll be covered in network. But if it's not a medical emergency and you just want to go see a cardiologist in Pinellas County, Florida, you're likely going to have to pay the full cost. There are some Advantage plans that do have a national network, but for the most part, most of them will only cover you in a medical emergency if you're outside the service area. So there are network limitations with these plans, right? Even on a PPO, even if you do have out-of-network coverage, it's still up to that doctor if he or she wants to accept the terms and conditions of your plan. What they may do to you is they may say, you know what, Gigi, I don't want to take your plan. We don't want to deal with the company. We're going to make you pay up front and we'll give you an itemized receipt and you have to submit it to your plan for reimbursement. Okay. It's nice to have as an option, but there's no guarantee that they're going to bill it directly on a PPO because you're paying as you go. In the event your health does change, and I say it like clockwork, in the event your health does change, your out-of-pocket costs can start to pile up. If you're seeing several doctors a month or you have a diagnosis like cancer, it can become expensive. And yes, you do have that maximum out of pocket to protect you, which is a good thing. However, it can become expensive. And I'll give you a prime example. I have a client, she didn't know about New York's guaranteed issue laws on Medicare supplement plans. So she was on her Advantage plan for 2 years going through cancer treatments. Her plan had a $7,550 maximum out of pocket. She hit the maximum out of pocket twice. So in 2 years' time, this lady had to pay $15,000 in medical expenses because on most Advantage plans, chemotherapy, radiation is always billed as a 20% coinsurance. It's not part of a specialist visit. And that's a thing that people have to know is when you go see a doctor, the copay you pay only is for if they meet with you, they talk to you, they do your vitals, and they write you a prescription. That's basically it. Maybe a little lab work, but if you do something that's more comprehensive, like you're doing gel shots in the doctor's office, or they're doing some type of procedure, that could result in an additional copay. So those co-payments can add up, especially for someone that has a lot of health issues. Prior authorization rules. So certain services under a Medicare Advantage plan are going to require prior authorizations, such as MRI, CAT scans, elective surgeries, right? If it's a medical emergency, there's no prior, you're getting admitted into the hospital, that's it. There's no, oh, we need to wait for the insurance company to decide. Not in that situation, but if it is an elective surgery, there can be prior authorization rules. So for example, let's say I need knee surgery. Under traditional Medicare, in most cases, they're just going to tell the doctor, go do what you need to do, right? There's no questions asked. But under an Advantage plan, they may say, and it depends, all plans operate differently. They may say, well, you know what, Caitlin, we want you to do 12 physical therapy visits first, and then we will approve the surgery after that. Or make, you know, we'll come back to it and make a decision. So there are prior authorization rules. And if you are, you know, the situation may be becoming a little more urgent, that could be a little bit of a nuisance for some people, right? So there are rules to follow with these plans. So these are the cons, right? If you're a high utilizer of healthcare, then this may not be the right fit. But if you are someone who's on a fixed income and, you know, you may have some health issues, but you're a pretty low utilizer, then this can be the right fit. The good news for you is that you live in a state that is a guaranteed issue state. So if you want to start off on an Advantage plan, and then as you see your health starts to change later on, you can always go onto a Medigap plan later on. And that's the beautiful thing with New York, right? You can go to the next one. Please watch out for these scams. I wanted to screenshot them so everyone could see them. I think I shared this last year. This is marketing and it's very misleading. That document on the left, it really makes it look like it's coming from the government. It's not. It's a marketing piece coming from insurance agencies that write it in a way to make it look official. Medicare does not mail things like this, neither does Social Security. Okay, my mother gets calls all the time. Yeah. And Facebook, Facebook is the worst because, you know, if you click something, it might automatically fill in your information for you, and then you're subject to all these calls. And so she got a call, you know, a text saying she's qualifies for $3,900 per year in a flex card benefit with a rollover. That does not exist in New York. It does not. But I see these commercials and it's very concerning. These kind of ads. There's a deep fake, I think, going on with looks like Joe Biden. It's not him, but it's artificial intelligence. And it's saying that seniors could get like $5,000 a year from Social Security. And it's very convincing. It's scary. But please watch out for things like this. There's no such thing like this. Even for people who have Medicaid in New York, even they can't qualify. There's no benefit like that. $3,900 a year. That would be great if there was, but there isn't.
And Medicare won't say, hey, Barbara.
Never. Medicare, it's not friendly.
They gonna say, hey, what's up?
The federal government's like the DMV. Don't expect them to be friendly. So if you get a friendly phone call from and then they say they're from the government, it is definitely not the government. I would question it though if they're a little rude and they have an attitude with you. Then maybe they do work for the government. All right, you could go to the next one.
You've always come here to double check.
Yes, if you get a marketing piece, I always tell people, please, you can show it to me. I'll tell you right off the bat if it's nonsense or not. Alrighty, so the biggest thing I want to talk about is 2025 in relation to Medicare Part D. Massive changes happening for next year. So I have the 2024 benefit and the 2025. So basically what this is Medicare releases a blueprint for Medicare Part D, and the plans have to follow that blueprint. So for example, you're not going to see a plan that has a $3,000 Part D deductible. It will either be in 2025, $590 or less. Okay, so what's happening is, and many of you who have been on Medicare for years knows that the donut hole has always existed since the start of Part D. And what was the donut hole? That was, you would pay your co-payments for your prescriptions, and then come June and July, all of a sudden you now were paying like $200 to $300 in these crazy amounts. What happened? You fell into the donut hole. That's going to be gone for next year. The donut hole is being completely eliminated, and that is good news. Beautiful news. However, there are some changes. So, first being, there is no initial coverage limit anymore. So in 2024, and the way it always was, is the insurance company would basically say, here's a bucket of money, right? This year it's $5,030, and that means here's a bucket of money for you, Caitlin, to spend on your prescriptions. Between what we pay as the company and what you pay, once you hit that dollar amount, then you fall into the donut hole. That does not exist anymore for next year. What's going to go on for next year is there is no initial coverage limit anymore. I guess you could say it's unlimited. There is no set dollar amount. You have an out-of-pocket threshold of $2,000, which is like a maximum out of pocket. So every prescription co-payment that you pay next year gets accounted for. And if you hit $2,000, then they pay 100% of your prescriptions for the remainder of the calendar year. So it will be level. That's what we're going to see next year. No more of this donut hole, which is very good for people that are on very expensive drugs. So I am happy to report that. So that's going to be a big change. But there are some caveats to this, and we will talk about that. So 2024, as you could see, completely different structure. And all the plans say it's going to be the same thing. So if you are on a standalone drug plan or you're on an individual Medicare Advantage plan that has the drug coverage built in, they're all going to follow the same blueprint where it'll have an out-of-pocket threshold of $2,000. Now, if you're not on really any expensive drugs, you're never going to meet that. But for the people that do take some expensive drugs, this is going to be more applicable to them. Okay. And the deductible, we are seeing that more plans are going to have that standard amount. And the deductible will usually apply towards brand name medication. So if you're someone that takes levothyroxine or atorvastatin or, metoprolol, those are usually always inexpensive. They don't apply towards the deductible. However, if you take something like Eliquis or Entresto, those are usually more expensive. So if your plan has a deductible, it's going to apply towards that. But the good news is that the deductible, they will count it towards the out-of-pocket threshold. So that's good. So very different structure for next year. Every plan will cover drugs differently. So Medicare does dictate that they have to cover at least 2 drugs per therapeutic category, but the cost of those drugs can vary from plan to plan. So for example, Eliquis can really vary from plan to plan, especially when we're starting to look at the brand name drugs. So just be wary of that. Okay, you can go to the next slide. Now, I like this. So next year, there's something called a Medicare prescription payment plan that's going in effect. And you have the option to opt in it if it makes sense for you. So what's going to happen is starting in 2025, Part D and Medicare Advantage plan enrollees can have the option to pay their out-of-pocket prescription costs in monthly installments to the insurer instead of all at once. So there are no additional fees if you select this option. You can select it at any time of the year. So how it would work is, in this scenario, is Mary takes Eliquis. Mary has to pay $590 deductible in January because her medication is a tier 3 on her plan. And we'll talk about that in a second. Mary decides, you know what, I want to do the Medicare prescription payment plan. Mary pays her drug plan then $49.16 per month, right? And then by December 2025, Mary will have satisfied her plan's $590 deductible. So in that scenario, Mary would not pay anything when she goes to the pharmacy to pick up that prescription, but she's going to be billed by the insurance company. Now, if you're someone who is taking an expensive drug every single month, it may not make sense for you. It just depends. You are going to have to call up the insurance company, ask them about the Medicare prescription payment plan, have them run your drugs and see if it makes sense. It will make sense for some people. It's not going to make sense for everyone. So definitely, but it is a good option to have, right? Because that can be very stressful. January is not always a good fun time for people. If your plan has that deductible, then you have to satisfy it. And then, you pay whatever the co-payment is after it's been satisfied. Some plans do not have a deductible. Some may have a low deductible. It just depends. Okay. Now, every plan puts the drugs in 5 categories, and they're known as tiers. So usually, if you want your drug to be a tier 1 or a tier 2. But if it's beyond the tier 2, usually it's going to have a deductible or you're going to have a higher cost share for it. But this is an option. Every company is doing it for next year. Okay. So it is something that may make sense for your prescriptions. Or let's say you're someone who takes there are some drugs that are you take every 6 months. They're like a specialty medication and they're expensive. That might make sense to break that down into installments over 12 months. So really talk to the insurance company about it and see if it makes sense. But it is a nice option that they're having for next year, called the Medicare Prescription Payment Plan, abbreviated for MPPP. So we go to the next slide. So big changes. So because of these changes, there are less and less drug plans available for next year. So this year we have 15 drug plans available in the Bronx County market, individual standalone drug plans. There are only going to be 12 drug plans for 2025. The lowest premium drug plan available for next year is $38.70 a month. I am not going to say what company that is. It was very inexpensive this year. It's going up dramatically next year. There are no cheaper plans for Bronx County. There's only 12 drug plans. Okay, so unfortunately, the reason this is happening is because the insurance companies are going to have to pay out more because of the changes in the Inflation Reduction Act. The other thing is, because of the Medicare prescription payment plan, I think they're anticipating if someone doesn't pay the monthly installment, they're not going to kick you off the plan. They'll kick you off the Medicare prescription payment plan. But we don't know how that's going to be enforced if someone does not pay. So I think that's some of the reasons why that we're seeing these increases. 2026 is when the government will officially start negotiating drug costs for Eliquis and Entresto, all those expensive drugs. So I think by 2026, all these little kinks will be worked out and it'll probably be a better year. But for next year, that's it. 12 standalone drug plans. We don't have those $10 a month drug plans anymore. They don't exist for next year. Okay, so if you're on a Medigap plan with a standalone drug plan, this is especially hitting those people very hard. I've gotten a lot of calls about it. There are many Advantage plans cutting back benefits for next year as well. So there are plans that are leaving the market entirely for 2025, and there are many that are cutting back on dental, over the counter. Some plans are going to be adding medical deductibles next year, which is unheard of for Advantage plans, but there are going to be some that are going to be adding medical deductibles. And, it's not the end of the world. You don't want to freak out and go, oh, no, I got this deductible. In a lot of cases, the deductible is only going to apply towards things you do that's outside the doctor office setting. So typically you'll see it might apply towards outpatient surgery or, maybe inpatient. You got to look carefully if your plan has that deductible. So there is going to be rollbacks. If you are a QMB only, now that's Medicaid lingo. There are different programs for Medicaid. There's full Medicaid and then there's partial. If you are a QMB only and you are on the Aetna Assure plan, right? That had a lot of rich benefits this year. They're going to be rolling you into, for next year, it's a crosswalk, the Aetna Assure QMB plan for 2025. So if you are a QMB only, they're going to change your plan for next year. You are going to lose some benefits significantly. But there are some changes. Anyone who is a QMB plus or a full benefit dual eligible will not be impacted. So you'll stay in the current Aetna Assure plan and maintain similar benefits for the 2025 year. Aetna has already alerted you. So if you got a letter saying, dear so-and-so, next year your plan will be changing to the Aetna Assure QMB, then you are being impacted. Okay. If you did not get that letter, then you're not going to be impacted. You're an FBDE or a full Medicaid, but you can always call the carrier to double check. Now, if you are on Aetna Silver Script, the Smart Saver, or the Silver Script Plus plan, Aetna is going to be crosswalking you, which crosswalk means they're not terminating, they're just going to route you to a different plan internally, to the Silver Script Choice plan for next year. So you're just going to be routed to that plan. If that's happening, I will call Aetna and see what your drug copays are going to be for the Silver Script Choice for next year. Okay? If you don't like what those changes are, then you have the option to elect something else. Okay. So just to be aware of that, they're crosswalking you. Okay. You could go to the next one. So these are the plans that are leaving as far as Medicare Advantage are leaving Bronx area for 2025. These are the plans that will no longer be available in 2025. You are going to have to elect a new plan, okay? You will have till December 31st to make a plan change because your plan is leaving the service area, right? If you want a January 1st effective date. So United Healthcare is really doing a lot of trimming for next year. So these plans, which have been around, some of them have been around for a very long time, they are leaving the area. So you're on AARP, Medicare Advantage, the regional PPO. There's two different regional PPOs that will be leaving. The Patriot plan, that's leaving as well. One of the HMO plans is leaving, and the Aetna Platinum plan is leaving. So if you are on any of these plans, your plan is leaving for next year. You will have to find something else. Okay? And this is probably the biggest disruption because I've never seen a major carrier make disruption like this. Westchester County is getting even worse. But yes, very, very, very big changes. So make sure if you are in a United Healthcare Medicare Advantage plan, if you didn't get anything in the mail, still for good measure, call the insurance company up and ask them if your plan is being impacted for next year. Okay, the next one. So this is Epic, and I always like to talk about Epic. It's a great state pharmaceutical assistance program. I think it's really important for people to have. Most seniors are eligible for it. So as long as your income is $75,000 a year or less, or if you're married and your income's $100,000 a year or less, you qualify for Epic. The way it works is they have two different programs. It's not a drug plan, but it works in conjunction with your Part D. Now, the reason I really like Epic is I always recommend it for our Medicare Advantage plan clients in New York, is that it allows people one time out of the calendar year, at any time, you can use it one time to make a plan change. Why would you want Epic? Well, if you're on an Advantage plan, right, and it's June, there's no enrollment periods in June, and you get a phone call that, hey, you have cancer, and you're going to have to do X amount of treatments for chemotherapy, and you're looking at your Advantage plan, and you're like, well, I'm going to have to pay 20% for that, and my plan has an $8,000 maximum out of pocket, and I'm probably going to hit that maximum out of pocket. Don't worry, you have Epic. We can use that as a special election to take you off Epic, to take you off your Advantage plan and put you on back to traditional Medicare with a Medigap policy, drug plan, consecutive switch, and go do your services without having to worry about that high maximum out of pocket. So see, these are some of the great loopholes in the state of New York that really do benefit seniors. So although those premiums are very high, you can take advantage of these loopholes, which are legal loopholes in the state of New York. I know the insurance companies don't like it, but it's there to benefit you, because the state actually cares more about the beneficiaries than they do the insurance companies, which is good. So that's why you want to have Epic, even if you're not on any prescriptions. You want to have it as a safety net if you are one of those individuals who's on a very fixed income and those Medigap premiums are expensive here, and you're on an Advantage plan. You want to have Epic in your back pocket in the event something changes. Right. And we see, statistically speaking, if you're not coming onto Medicare out the gate with health issues and you're relatively healthy, or have some minor issues, late 70s, early 80s is when we start to see people utilize their Medicare a lot more. And there are Kaiser studies done on this, and I think it's like 75 or 76 into the late 80s is when people start to really utilize their insurance a lot more. So you want to have Epic in the event something changes, or maybe your doctor prescribes you a new prescription and it does not work with the current plan you're on, right? Well, you have Epic, you can then look for another plan that may cover that prescription at a more economical price. You could go to the next slide. And these are the two options. So most people fall under the deductible plan. So basically how it would work is if you're single and your income is over 23,000, or if you're married and you're over 26,000, you're going to be put on a deductible plan. And most people are never going to satisfy this deductible. I'm curious how this is going to work with this Inflation Reduction Act, because in some ways Epic may not be needed anymore. But how it would work is, let's say I'm put on, a very expensive drug and I'm on an Advantage plan. Well, my plan may have a $590 deductible. I would have to satisfy that deductible first, and then any co-payments I pay at the pharmacy would then get accounted for towards my Epic deductible. And it is based on your income. So if my income is $29,000, I'm likely going to have a $725 deductible. That doesn't mean I'm paying that in one shot, but every co-payment I pay gets accounted for. And then if I reach the Epic deductible, then Epic is kicking in, and then the most I'm paying for an expensive prescription is $20. So it is there in the event you do get prescribed something expensive, but really, especially now with the Inflation Reduction Act, it's really there for the people, especially if you're on Medicare Advantage. If you want to make a plan change, you need to change. And we're not in an enrollment period. It's your safety net. And that's the fee plan, which I think is I don't know why, it's very counterintuitive. So if your income is lower than 23,000 or like under 20,000, you have an annual fee you would need to pay to Epic. So for those individuals, if you're in that income bracket where you would fall under the fee schedule, then it makes more sense to go to Epic when you absolutely need it, right? So yeah, you could go to the next one. But most people will fall under the deductible plan. Oh, you could snooze.
I know, I just wanted it to get
Oh.
I was doing so good, right?
No, you're doing good.
Okay, hold on.
I mean, the screen's right there. You just gotta hit that. Oh, I don't know why it keeps doing that again.
I'm just gonna do this.
Yeah, just minimize it. That's fine. Okay. Okay, there you go. So how we can help, we can assist if you're aging into Medicare. We can assist you in enrolling in traditional Medicare Parts A and B, educate you on the different options in the individual Medicare market. We can research your doctor's medications and finding you the most suitable and economic solution for your needs. We do represent multiple carriers in the area. So I can tell you, I do work with Visiting Nurse Service of New York, Elder Plan, Health First, Aetna, United Healthcare, Cigna, Humana, Blue Cross Blue Shield, WellCare Fidelis, MVP, but that's more Westchester, Globe Life, that's another company. I'm sure there's others, I can't name them all, but pretty much most of the carriers we do work with. I don't work with Centers for Healthy Living, which is kind of more long-term based, but for the most part, we do represent most of the important carriers. So we can guide you through the red tape, but really we do more than just enrolling people. So really where we come in handy is when you have a problem, right? We do more than just help enroll someone and go, hi, see you later, see you later, never see you again. We help find, programs to help you. So, for people that maybe cannot afford a Medigap plan and they're in that weird income bracket where, they can't get Medicaid, we can help find you grants. We have gotten people grants for cancer treatments, to help pay some of the co-pays on their Advantage plan. We find people Medicaid, other programs that can help. So, our services do cost $0 because we are paid by the insurance. Okay? And it does not matter what Advantage plan you enroll in or drug plan. The amount they pay us is exactly the same from company to company, and Medicare made it that way, which is good because there is no favoritism towards one company over another. Okay. So yes, they pay us the same. So even if you call the insurance company yourself and sign up directly with the insurance company, it's the same thing. If the plan benefit does not change at all. So you can either enroll yourself if you like to, we can help you. So like these companies, these plans are changing. I feel more and more from year to year. So people really do have to start to be more on top of it. It's not like it was like a couple of years ago. So yes, we will help you through all that red tape, especially if there are coverage issues. You know, we will escalate if there's a prior authorization issue, but everyone's situation is unique. There is no one size fits all. And I know Margie always says that there is no one size fits all. So everyone's situation is completely different. And we will work with whatever is specific to your situation and find you a solution specific to your situation. So with that, you can go to the next slide.